Welcome back. Loneliness isn't just a passing emotion or feeling. It can have a profound impact on both our mental and physical health. It can lead to depression, heart disease, diabetes, obesity, addiction, dementia, and more. You know, that mind-body connection is something we've been trying to understand for many years. So what does the science say? Dr. Savage.
Yeah, well, I think loneliness has been getting a lot more attention recently because now we do have really robust evidence of the effects of loneliness on our health and well-being and just sort of how far-reaching those effects are. There was actually, just recently an updated systematic review and meta-analysis published, but the one that I think we're all familiar with and often cite is one by Julian Holt-Lundstad from 2015, and she was able to show, based on more than 1 million individuals, that loneliness increases our risk for premature mortality by about 30%. So benchmarked across other, really important risk factors for mortality like smoking, obesity, air pollution, loneliness is right up there and really needs that same level of attention.
What's the line between loneliness and depression?
Well, I'm not sure if there's a line. It's almost like Venn diagrams because you can be, if you're lonely, that can lead you to feel depressed. But if you're depressed and you're not feeling socially connected and people are reaching out to you and they want to speak to you, they want to bring you out, but you're not reciprocating or you're not even attending when they invite you, you start seeing that, oh, my social circle is it's diminishing. They're not reaching out to me. And on top of that, if someone is depressed, if they're lonely, their sense of self, their self-esteem, their self-image, it can be severely negatively impacted. And so they feel like that they're a loser or they're not lovable. And then they start seeing people drift away because they're not able to connect with them and people start to give up. And now that's seen as evidence. Oh, that's proof. That I was only feeling this way. Now I actually have the evidence that I'm unlovable. And so it feeds into itself. It can be really insidious. And people, because someone could be depressed and not even know it. And a lot of people won't know it as well because it doesn't just mean that you're feeling sad and down. It can also be that you've lost interest in things that you normally enjoy. So you can be going to work, you can be showing up to events, but internally, you've reached a point where you are physiologically, emotionally, psychologically not functioning well. You are actually depressed, even if you're not aware of it. So it's hard to know when exactly it starts. And as I said, I see it more as kind of like a feedback loop. The loneliness and depression and the loneliness, that's how I see it.
It's a bi-directional relationship. People who are lonely can then go on to become depressed and vice versa.
So I also think the problem with loneliness is that there's a stigma around it. So it's hard to admit that you're lonely, or even if you do, people just tell you, oh, learn to be alone or pick up a new hobby or this or that, when it's not that simple. And so if you admit to it and if people run away from you, then you feel shame that you even admitted in the first place.
I think people just aren't also taught what it feels like. It can show up as physical symptoms and you don't know that that's loneliness. Mm-hmm. And so we see those people showing up at community health centers with their doctors. They go for repeat visits. And then once a social cause is identified, and that through social prescribing or other kind of models, they're able to refer those people to social activities or other kinds of supports, then you see that they start to feel better and they visit the doctor less.
And I think the real important message is that we can all be part of the solution to the disconnected world that we're in today. We don't always need to wait till somebody's in a crisis. And to Miriam's comment, she may have felt that way, and trying to encourage her to get back out there and be social may be a little overwhelming, a little daunting at the time. But what if every one of the people around her, the people who know her, took an effort to say, hey, Miriam, do you want to go have a coffee? Do you want to go for a walk? Do you want to go for a hike? So when we have 40 million people in this country, if we can raise the collective consciousness of the role that we can all play in solving this crisis that we have on our hands, I think we can make the world a happier and healthier place.
I want to tell a story about somebody that I miss. I'm sure he died of loneliness. I mean, at a very big age. I featured Bernie in a previous show. He was our oldest tennis player at 98. He was at the tennis club every day. He had dinner with the squash pros, and this was, the center of his life. And he was actually, I'd see him on the next court on Sunday morning. And, when everything totally shut down in the pandemic, then I heard that Bernie passed away. And I'm sure that it was suddenly he was all cut off from there, because I didn't hear that he was sick or anything.
Yeah, we've been hearing lots of stories, unfortunately, like that. And I think the pandemic has really shone a spotlight on how important social connection is to, our lives. And there's really a need to nurture it. I like the comment earlier, and I think it addresses sort of some of our earlier discussion about stigma. People think and don't like to even use the word lonely. In research we've done, people will be talking about the experience of loneliness without actually saying the words because they don't want to use that language. And we really need to be thinking about it as, nurturing our social health and well-being. It's a biological response to, something that we need as humans. We rely on others. We're social beings. And so just like, when you're thirsty, you have a sip of water. When you're hungry, you eat. When you feel lonely, it's actually your body urging you to connect with others. And we should be paying attention to that and responding to it.
We will have more after the break. Stay with us.